No, I do not.
No.
Yeah.
No.
I do not.
No.
Should I?
No, I don't know. No.
Yes.
What can you say about her?
Nothing.
I'm trying to remember, but she had special cells or something that they kept living or kept dividing or something when everybody else's cells wouldn't, and they died or stopped dividing or something.
Yeah, you do. Yes. Will you tell me about her? Anything you know?
So I don't remember her life background or anything, but I know she was fairly poor, and she died of a certain type of cancer, which was harvested from her for research purposes and was never compensated. This is my major.
Yes.
Will you tell me what you know, please?
She essentially was this African American woman that had cancer, and during a biopsy, cells were taken to do research, but she wasn't aware of this fact, and neither was her family. So her cells have lived on even though she died many years ago. So they continue to be used for research.
No.
Helo cells? Helo cells, yeah.
Helo cells?
Helo cells. No.
No.
No. What? Helo cells.
No.
Okay.
No. All I know that she has to deal with something with ovarian cancer or something.
Isn't that the cells that they keep replicating to keep using? Or her mortal cell line?
Cells or something that they kept living or kept dividing or something when everybody else's cells wouldn't, and they died or stopped dividing or something like that.
Will you... Cell line. Okay. Immortal.
Are we talking about sexual consent, or are we talking about consent in any form?
I guess I mean specifically between a researcher and a participant, or a doctor and a patient.
I mean, they can't perform any medical procedures on you without your consent. They should tell you everything that they're going to do to you before they do it.
Yeah, you should have a full understanding of the procedures and everything that's going to happen.
Oh, I don't know, verbal acknowledgement of you, giving, actual permission, vocalizing your permission to do whatever you want.
Both, signing the forms and verbalized.
Exactly, yeah.
Consent, I guess. Yeah.
Informed consent? Is that with asking the patient if the procedure is okay and what their name is?
As I understand it, informed consent has a couple of different definitions. It can be one where the patient fully is aware of all of the possibilities and makes a decision based on that, or one where the doctor presents a limited set of possibilities, options, and the patient chooses from those. But basically holistically, it's just when the patient fully understands what's going on and makes a decision about the treatment progress based on that.
Yeah, really roughly just kind of knowing what's going on and knowing what potential risks are, what procedures will happen, and I think that's most of it. Yeah. That's it.
I would say it's the doctor or nurse making sure that whatever they're about to do, a surgery or something, to the patient, making sure that it's okay with them and that they know what's exactly that's going to happen in the procedure and everything.
Informed consent, the person has to be fully aware of what they're consenting to, right? The doctor has to tell them everything that they might want to know in terms that they can understand. And the person has to soberly and enthusiastically say yes to that, whatever it might be.
Physician goes over what the rules and regulations are, what the procedure is going to be, how it's going to be performed,
informed and the patient gives their consent to the physician that he can do the procedure. But they have to be fully informed of all the risks involved.
For me, it means that the person who's doing the study or doing the procedure on the person, so the patient, has explicitly explained what is going to happen, the risks, and then has allowed time for the patient to ask questions and actually think if this is what they want to do. So there's been a conversation on both sides and it isn't a rash decision unless it's necessary for medical reasons.
Sometimes.
When do you not trust doctors? Or like why sometimes?
Just when like I know what's wrong with me,
Mhm.
and they say something else. Yeah.
Yeah.
Yes.
Do you generally trust researchers?
Yes. Generally.
Why do you say skeptically?
I like to do a little digging. You know, if you're gonna like look at research, you need to know who's funding it and you know how the research was done. Like you can't blindly accept things that people say. But I think that in general, researchers are following the scientific method and they're trustworthy. I think doctors are the same. You know, there are obviously exceptions, but in general, yeah.
Same, yeah.
Yes.
Why?
I feel like they went to school for so long and have so many resources and like they've done so much research and they probably know what they're talking about. They know more than I do.
Yes. I'm a nurse, yes.
Okay.
How about researchers?
Yes.
Yes.
Yeah, because I've been involved in research, yes.
Yes.
Yeah.
Why?
Because they are trusted medical professionals that went through a lot of schooling and have used science to back up their research and the reasons why that they do what they do.
Yeah, I agree with that, and it's like hard to think that like who am I to question people who have gone through like so many years of training for like what they do.
I would say so because I do research and like the people that I'm with are trustable or trusting, but I don't know, doctors you want to trust because they've gotten so much schooling, so I would say generally, but like there's always people that you think aren't trusting. Yeah, generally.
Well, I trust mine.
I trust mine.
Yeah.
What about
Depends on how long-
researchers?
Sorry?
Sorry, go ahead.
Research.
I guess it depends on the topic.
Exactly. Yeah, it kind of depends on like whether or not I know the firm, like the company from which like these people are coming from.
I like to hear like opinion on the topics.
It depends. It depends on like how well their study has been done and like what their kind of research, you know, like how their evidence backs it up.
Do you generally trust doctors?
I'm being honest, I think they're pretty arrogant, and some of them, especially when they're really new, want to show off more than they actually know, and they're kind of bullshitting their way through it for the most part. And, like, yes, they need to learn, but they also need to learn that like they aren't this like overall like supreme human being, and they need to be like knocked down a few levels to like where they're actually supposed to be in the world.
Yeah, definitely generally.
And do you trust researchers?
Yeah, I mean with both there are always going to be exceptions. Like there are always researchers who like fake results, or doctors who like Larry Nassar, or like other horrible people who abuse their power. But generally, yes.